you so much for attending our program Stroke Information Session. My name is Rachel, and I'm the Health Literacy Specialist with Vaughan Public Libraries. I'd also like to extend my thanks to Newmarket Public Library for partnering with us on this program. I'm happy to introduce Anna Sewell from Mackenzie Health, where she is the District Stroke Coordinator. She'll be leading this session about learning about the risk factors leading to strokes, how to identify a stroke taking place, and other important facts in this presentation. Anna, thank you so much for joining us.
Thank you so much, Rachel, for having me, and also to you and the Newmarket Library for coordinating this evening for people so that they can access what I believe is very important information for them and their health. My name is Anna Sewell. I am a registered nurse. I've been a registered nurse for almost 22 years. Originally come from New Brunswick. I've worked in 4 different provinces, and more than half of my career has been spent in neurology. I worked in neurotrauma and also, mostly in stroke. Stroke is something that I'm very passionate about. I've seen stroke from many angles. I was a bedside nurse. I was an educator, clinical nurse specialist. I managed a stroke unit, and now I am a district stroke coordinator. And what does that mean, district stroke? Well, in the York region, we are considered a district stroke center. There's many stroke centers within Ontario, and within the Central East Stroke Network, there are actually 5 district stroke centers. And what that really means is that we have the hospital that houses the medications, which is a clot-busting drug that we're able to give if somebody has what we call an ischemic stroke, which is a blockage of a vessel in their brain. So we have agreements with the EMS, our paramedics in the York region, that they will bypass your local hospital and they will take you to Mackenzie Health. So the District Stroke Center Hospital is the Cortellucci Vaughan Hospital. It used to be at the Richmond Hill site, but in 2020, Mackenzie Health became a 2-site hospital. So we have the Richmond Hill site and we have the Cortellucci Vaughan site. So the District Stroke Center was moved 20 minutes west to the Cortellucci Vaughan site in a very, very beautiful new hospital. And they have what they call an integrated stroke unit that has both acute stroke care and rehabilitation care on the same floor that takes place in your same bed if you're admitted to that hospital. So just to kind of give you a background of what does that mean to be a district stroke center. So we deliver this TPA, what we call the clot busting drug, for residents near Markham Stouffville Hospital, Uxbridge Hospital, South Lake Hospital, and Richmond Hill site as well. So I just kind of wanted to give you some of that background. So I'm going to share my screen. I just want to let you know that the information that I'm going to give in my presentation, in no way does that replace any advice that you get from your family physician or your healthcare providers. My information comes from Heart and Stroke Foundation and also comes from the Canadian Stroke Best Practice Guidelines, which is what we practice by in the District Stroke Center. So that's where the information comes from. But it's all for learning purposes, and it's not to give you direct medical advice that would be, taken more than what your family physician or your healthcare provider is currently providing for you. So I just wanted to put that statement out there to make sure that everybody understands. And so what I'll do now is I'll share my screen. Can you see my screen now?
Yep, looks great.
Perfect. So as you know, we're here to talk about stroke, and I'm so glad I see 16 participants online. This is fantastic. This is really a high number for me, and I'm very happy to see that you've all taken time out of your evening to join me to have this discussion. What I hope to do is, because of the recording, I would like to present the slides and leave enough time at the end. I'm hoping for at least 15 minutes so we can, as a group, talk about stroke or some of the questions, or maybe you want to share some of your experience with us. That would be really lovely. I'd really like that. So what I hope to cover in the presentation is some facts about stroke in Canada. And then from there, I want to talk about what is a stroke. What I find in the community often is I'll ask people, well, what do you know about stroke? And it's surprising, but even with all the marketing campaigns and everything that have gone on over the years, there's still quite a few people that don't know much about stroke. And What did surprise me, though, in my community outreach is that the young generation, the children, are actually learning more about it in schools. And so they're actually quite good at giving a description of what stroke is and how to detect stroke. So I'm hoping that they'll help spread that word as well. So once we learn about the types of stroke, then I'm going to talk about what are the signs and symptoms of stroke, because I think that's really crucial to, accessing the care that you need at the right time. And then we're going to talk about some risk factors. So what are some of the things we can change to help reduce our risk in stroke, and what are some of the things we can't change? And then I'm going to talk a little bit more specifically about women in stroke. And then we're going to get into some of the, blood pressure, healthy eating, what the recommendations are, alcohol consumption, smoking and vaping. And then I have a little bit of information there to help people if they're looking to quit smoking. So that's kind of the agenda for the presentation, and that's how we will discuss it. So some things you may find very interesting about stroke is that it's the leading cause of adult disability in Canada. So stroke is also the third leading cause of death. And sadly, about every 10 minutes, someone has a stroke in Canada. And, where I work with my colleague, clinical nurse specialist, his name is Paul Corteza, we actually see the strokes that are coming in to the emergency department. And, sadly, in the course of a day, we can see 5 or 6 strokes coming through our doors. And so it's very sobering because that this is really an important health issue, health crises that we're dealing with. Every year, more than 50,000 Canadians suffer a stroke, and 14,000 of those people will actually die from the condition. And 9 out of 10 of us have at least one risk factor for stroke. So these are just some of the statistics that we have from the Heart and Stroke Foundation that we want to share with people. Not to scare you, but I think it's really important for you to understand, the magnitude of stroke and how it's impacting us. And in fact, all ages of people are impacted by stroke. They say probably about 405,000 people in Canada are living with the effects of stroke. So that's pretty significant. And yeah. So what is a stroke? When you look at this picture, it looks complicated. It's showing you all the lobes of the brain. Stroke is really any interruption in blood flow to the brain. And when you have that happen, it causes cell damage because, of course, like any other muscle, tissue, things in our body, we need to have access to oxygen and nutrients. So the minute that the brain does not have that, the damage starts right away. The kind of effects you're going to have from the stroke depends on the location of the stroke. So, some people might say, well, I know so-and-so had a stroke and they couldn't speak, or I know so-and-so had a stroke and they couldn't walk. It just depends on the area of the brain and which side of the brain was damaged. That is the effect of the stroke that you will actually see. Sometimes people think, oh, well, strokes, they mostly happen to older people. Yeah, you would be correct to think that, but we're seeing them at all ages. And in recent years, we're seeing them at younger and younger ages, which is very alarming. So stroke is an interruption to the blood flow of the brain. So there's different types of stroke. So we have something we call an ischemic stroke. Ischemic stroke is really a blockage. And 80% of our strokes are this type, they're blockage. And so this is why we're really trying to get out to the community to say that if you're having signs and symptoms of a stroke, you need to call 911 because the EMS can take you to the appropriate center in the York region. That would be the Cortellucci Vaughan Hospital. And if you're in the right time frame, the time window, then you can get a clot busting drug that will often help open up that artery and feed those starving cells. And the faster you do that, the better it is for you and your outcomes. because stroke, as you've seen, it's the leading cause of disability in Canada. So the faster you get the treatment, the faster that you can prevent further damage and start your road to recovery. Right now, if you get to the hospital within 4.5 hours, they may be able to give you the clot busting treatment. If you go beyond this window, then there is still other options. We have something called EVT. EVT is endovascular thrombectomy. Sounds very complicated. What it actually is just the neurologist or the neurointerventionalist will put a catheter up in through one of the large arteries of the groin, feed it all the way up to the brain, and they will actually remove the clot from that large vessel that's occluded. So this treatment became available to us in Canada in 2017. And the clot busting drug treatment that I talked about, that became available to us in 1999. So more than 20 years ago in stroke, we didn't have a lot of options. We didn't have a lot of, treatment options that we could offer patients. Often they would come in and yes, of course, we would look at their blood pressure and those types of things, or irregular heartbeat or those kinds of things, and try to mitigate that. But we really didn't have a lot to offer them in terms of opening up those arteries. And so, when the stroke network was formed in Ontario, it actually put a lot of emphasis on the research and, of course, all the good work that the Heart and Stroke Foundation have been doing over the years with their research. They really pulled together people provincially, nationally, and internationally to figure out what are the best treatments and how do we advance stroke care. And so as a result of their hard work, we now have these two treatments since that time that we can offer patients. And they really do make a huge difference in the lives of the patients and really in preventing disability of patients. So the first stroke, as I said, 80% of them are blockages. They're called the ischemic strokes. And then we have something you've probably heard of before called a mini stroke. In mini strokes, the technical term we use for that is transient ischemic stroke. So meaning that you have a clot that's traveling in the artery, and sometimes it'll be lodged and it will, occlude the blood from going through that vessel. But then it will reopen again. So you may have symptoms, anywhere from 1 to 24 hours usually, and then the symptoms will go away. So that's what we call a mini stroke. So the symptoms that you're experiencing are not permanent at that time. They are often precursors, or they tell us of an impending stroke. So that population of people really need to get into their healthcare provider and to be seen and addressed. And the third cause is a hemorrhagic stroke. So it's actually most commonly caused by high blood pressure and a weakening of the vessel, and the artery will actually rupture. So that's called a hemorrhagic stroke. I can see that my screen is trying to advance on me. So how do you detect a stroke, right? So there's more signs than these on here, but what we're trying to do, or what the Heart and Stroke is trying to do with this acronym of FAST, is to help give people the confidence to recognize and react right away, because with stroke, time is brain. So every minute that we delay treatment, it's about 1.9 million brain cells that are damaged. So that's pretty significant. So what we try to teach people in the public is the acronym FAST. So if you notice changes in your face, one side of your face is drooping maybe, or the muscles are not working properly, or you can actually see the facial droop, that's the face element. Arm is when you get people to raise their arms at 90 degrees and they're unable to sustain their arms in that position. You might see one falling, we call that a drift, or they're just very weak and can't move their arms up. That's another sign of stroke. S is for speech. So if you're talking one moment and you're very clear, and in the next moment you start to have trouble word finding, you have trouble with pronouncing, you sound very slurred or jumbled, that's another sign that you could be having a stroke. And T, we always say time to respond, time to call for help. So 911, don't even wait. I know that sometimes people are like, I don't want to, alarm anyone. I don't want to go to the hospital for nothing. The main thing about these signs of stroke is that it's not something you're always, experiencing. It's not something you've experienced before. It's a new onset. So it's a sudden difference involving your face, your arm, your speech. And of course, it's time to act, right? So stroke is a medical emergency. We want people to know that. People are pretty good at realizing, chest pain as a heart attack. But we need people to really be aware that, any changes in the face, the arms, the speech, these are signs of stroke, and it's a medical emergency the same, and you actually need to call 911. So you go to the appropriate place for care. So as I said, every minute, so we say time is brain. So every minute in delay in treatment, on average, a person loses 1.9 million brain cells. So each hour in which treatment doesn't occur, the brain loses as many neurons as it does in almost 3.6 years of normal aging. So can you imagine in a couple of minutes or 3 minutes, you've lost 10 years of neurons to what would be normal aging? That's very significant. So when I showed you the agenda, I said we would talk about things we can change and things we can't change in order to reduce our risk for stroke. Some things we can't change. So our age, we don't have any control over that. We're aging. As we age, our risk for stroke increases. So every 10 years after the age of 55, and 55 is very young, our risk for stroke doubles. So age is one thing. Ethnicity, there's certain groups of people that are more prone to stroke through other means, like having high blood pressure, family history of stroke. So African American people, Asian people, Aboriginal people tend to have higher risk if you come from these different ethnic backgrounds. So yeah, that's something else we can change. Family and medical history. So if stroke and heart run in the family, so heart and stroke actually go together because they're both part of your vascular system. And so if you have risk factors for stroke, you often have risk factors for heart disease as well. So we can't change our family medical history. Personal circumstances too, because the things that determine our health, the determinants of health, our economic status, our access to health, those kinds of things, they impact our risk as well. And gender. So women have a tendency to experience strokes at different points in their lives. And I'll talk more about that on a slide that I have for women and stroke in particular. So 1/3 more women die of stroke than men. And some of the risk factors for women are really the changes that they go through in their hormones as well. So like pregnancy is a particular high area of risk for stroke. Menopause, women tend to live longer than men in Canada. So just by that fact alone, their risk factor is a little higher. Women will be often on birth control pills. There's also hormone therapies. And then there's also the gender affirming hormone therapies as well that can increase your risk for stroke. And again, I talked about ethnicity. So that plays a factor. And then things like different types of diseases that you might have, like atrial fibrillation, which is an abnormal heartbeat that creates disruption of the flow in your heart, which can cause clots that get thrown into the circulation and they get lodged in the brain. So those were the things we can't change. So those are the things we're born with. But there's a lot we can do. There's a lot of things we can change. And, you know, we can reduce our risk factor for stroke by as much as 80% just by taking care of the diet and exercise that we maintained for our health. So we can control things like unhealthy eating, and we can control smoking, we can control our alcohol consumption. We can try to keep and maintain a healthy weight. And for medical conditions, yes, some of them you may be born with, but we can manage them. Compliance is a big issue. Often, you know, people are given advice of what to follow, and sometimes it's very hard to follow, but sometimes we're just not compliant with what we've been recommended as well. Physical inactivity is a big deal, and of course, stress. So we're going to talk in more detail about each of these things. So I'm just taking us back a little bit before to talk about the stroke care. When I started to introduce the District Stroke Center and what we do, here are some images that can help you to see what it is that I'm talking about. So if somebody's experiencing signs and symptoms of stroke and they call 911, what will happen is the EMS will follow a paramedic prompt card. They have a prompt card. The province follows, all the EMS follow the same prompt card. And they will look to see if you do have signs and symptoms of stroke and you're within the 4.5 hour time frame from last seen well. So when your symptoms started, they'll bring you to the hospital. And the first thing they do is a CT scan of your head, because they want to determine, can we see a stroke? So in this slide here, if you look at the left-hand side of that brain image of a patient, you can see that it's all black. This is indicative of a stroke. This is a very large stroke. But the first thing they want to do is look for evidence of a stroke, but they also want to look for evidence of a bleed. Because if you have a hemorrhagic stroke, of course, we're not going to give you a drug that's going to, you know, cause your blood to thin like the clot busting drug would do, because that would do more damage. And so they will confirm with a CT scan. Most CT scans actually don't show stroke right away. And so that person would then be followed up for either a repeat CT scan or an MRI. But once they've determined that you're having a stroke, then if you're in the window of 4.5 hours, they will give you the clot busting drug. We call it TPA. The name of the drug is Alteplase, but TPA is the short for that drug. There is a new drug from the same company that is showing to be non-inferior, so just as good as TPA, that a lot of the hospitals in the Central East Stroke Network are looking to change to right now, and that's called Tenecteplase. So it's just a bit of a variant of the original drug that we've been using since 1999. But this drug, the way it's made up, the way it's composed, it seems to target the clot a little bit better. And one of the best things about it is that it's really easier to give, faster to give, because the way that we give this current drug is in a little mouth bolus, what we call it, and then we run an infusion over an hour. Whereas if we switch to the new drug, we'll be able to give the whole treatment in over 5 to 10 seconds, which means getting the drug into the patients faster. So at Coeur d'Alluche Vaughan Hospital, we have a working group together right now that's looking at transferring over to the new drug. And we don't have any firm timelines right now, but we are hoping that, you know, before the end of the year, to be able to offer that new drug to our residents in the York region. We have not made any official announcements yet, but just telling you as a district stroke coordinator that that's something we're working towards. And then endovascular thrombectomy. So as I said, if you're out of the window for the clot buster, you may still be eligible for the 24-hour EVT treatment. That does not happen at the Cordalucci Vaughan Hospital, but we work with our partner hospitals in downtown Toronto. We mainly work with Sunnybrook, and Sunnybrook will take the patients to do the EVT treatment. So just to kind of explain that process to you. And, you know, often when people go to Sunnybrook for the treatment, they will stay in an intensive care for 24 hours and then they'll be returned to Cordalucci or to their home hospital, wherever the best level of stroke care can be provided to them close to home. So we call that repatriation. So we also have agreements around that. So there's a flow of patients, there's a flow of movement in stroke care that happens in the York region that's very coordinated. And so that all happens, you know, even if, you know, you don't come by 911, but it all gets triggered by, you know, ambulance. So what I'm really trying to stress to you is if you have a stroke, please call 911. So now we're looking at the modifiable risk factors. So blood pressure is the #1 risk factor. Why? Because as your blood pressure increases, it exerts pressure on the walls of the artery, and over time that weakens the artery. And so that makes the artery more prone to rupturing and more prone to stroke. And, you know, they call high blood pressure a silent killer because, you know, often people don't notice the signs and symptoms of having a high blood pressure. So they may not even know that they have it. And in fact, we've done blood pressure clinics in the community and found people with very, very high blood pressures and have sent them to the emergency department for treatment because you know they're just enjoying themselves, they're doing things, and they don't even realize that they have it. Other people are very sensitive and they can realize when they have high blood pressure. Um, so so blood pressure is necessary to make the blood flow, right? And to deliver that oxygen and nutrients. And so if you have a rupture, of course, that's not going to happen. So what's a normal blood pressure? Normal, quote unquote. You know, the average blood pressure that we're usually aiming for is 120/80 millimeters mercury. That's how we measure it. But there's variations to that. So some people can be 140/90, it's normal, and others 130/90, it's normal, depending on if you have other conditions, heart conditions or diabetes or those kinds of things. You may hear from your doctor that, you know, they want to see you in the 130/190 range. So I just gave you some ranges there of what would be considered normal blood pressure. Healthy eating. So as I said earlier in the presentation, 80% of strokes can be prevented through a healthy diet and reducing blood pressure. So, and improving your overall cholesterol levels. Because cholesterol is particularly dangerous because, you know, if you have a lot of circulating cholesterol, it builds up against the arteries and it becomes, you know, a plaque. And it's dangerous for heart disease, but it's also dangerous for stroke because sometimes that plaque can completely block an artery or the plaque can break off and it can move up and block smaller vessels of the brain. So we really recommend that you follow Canada's food guide and a DASH diet, and I'll give you a description of what that is. But it's really a healthy diet that includes vegetables and fruits. You can see in the plate here, it has half of the plate is vegetables and fruits and proteins. And it really wants us to try and limit processed foods that have a lot of sugar, salt, and trans fat in them. Unfortunately, we have a lot of our diet is very processed. And so if you're not cooking on a daily basis and you're not paying attention to that, you can be consuming a lot more salt and sugar than you even are aware of, that you want to or are aware of. So we just want people to think about what you're eating and, you know, try to, as much as possible, you know, limit the overindulgence in the processed foods, you know, because they're dangerous for your health and your risk for stroke. So a DASH diet, you might have heard of this. There's lots of diets out there. I mean, of course, talk with your physician to make sure which one is best for you. But the DASH diet that's being recommended by the Heart and Stroke Foundation is it's a dietary approach to stopping hypertension. So it's really about reducing blood pressure by lowering bad cholesterol. And so they, similar to the food guide, they want you to choose a variety of foods, choose plant-based proteins if you can, very often. Again, vegetables and fruits, grains, low-fat or non-fat dairy foods, lean meats, poultries, and fish, nuts, seeds, and dry beans, and healthy fats and oils. So it's not something we haven't really heard before, and they're quite similar. It's just, you know, selecting things that I think, you know, are less processed is a really key piece to that. And here, I can make the presentation available to the group if you wish to have that, because there are some websites on here that you can go and explore. And this one is on the Government of Canada website, and it has, you know, ideas for healthy eating and a lot more information than the picture on there. So I would encourage you, if you're interested, to go and have a look at their website and see what they're promoting in the Canada's Food Guide. One of the main things for hypertension or blood pressure is, you know, shaking the salt habit. So sodium intake, you know, a normal average sodium intake for an individual is around 1,200 to 1,500 milligrams a day. And most Canadians have double that, and we don't even realize it. It's in our food. So, you know, we really encourage people to look at the nutrition labels when they're buying food in the market, to look at what is the milligrams of sodium. And also, if you look at what I have circled on the label, it'll say the percentage of daily value. So in this product, if you have 1 cup, it's telling you that that's 5% of your daily intake for salt. So trying to just keep an eye on that, making sure that you're not getting too much. So anything in a product that would be greater than 360 milligrams or larger than 15% of your daily intake, maybe you should avoid that product because it contains a lot of salt. Between 121 and 360 milligrams, you're going to say watch out. And then if you see stuff that's like 5% or less, then that's probably a good choice for your diet. So just want people to be aware. What happens with salt is it causes water retention, and the water retention means more volume in your body, in your circulation, and more volume, of course, causes more pressure again on the arteries, and so that's how it increases our blood pressure. So just want people to just pay attention to it the next time you're eating a bag of chips, or you're, you know, even, you know, some coffees. They'll add salt to the coffees. It just depends. So just have a look around, you know, on the drinks, the soda drinks, even bottled water sometimes will have salt added. So just have a look at your nutrition facts and just be aware, because sometimes just being aware will also help you to reduce. I never tell people to worry about, you know, food that comes in its natural source. You don't have to worry so much about the salt in that. It's the stuff that's processed, and when they add salt, salt is a really great preservative, right? So, so yeah, so just pay attention to what's in our processed foods or our packaged foods. Physical activity. So the more you're active, the greater your health benefits. They say that an adult should aim for about 150 minutes of moderate to vigorous aerobic activity weekly. And even if you can do them in 10-minute intervals, it's very beneficial. Choose activities that involve endurance, strength, and flexibility. And you're never too old to strengthen your body. So 150 minutes sounds like a lot, but really that's like about 30 minutes a day. And, you know, moderate to vigorous means like go for a deliberate walk, do something deliberate. It's not so much that I've been active for 30 minutes in the day. It's like, it's an actual exercise for your body. You've done, you've worked up maybe a sweat, or you've done something out of your normal routine for 30 minutes. Maintaining a healthy weight is really important. So 60% of Canadian adults are overweight or obese. So even, we're not telling people, you need to go back to what you were at 20. Even a modest weight reduction, as little as 5% of your body weight, can really reduce your blood pressure. So even, even sometimes 10 pounds of weight loss can make a huge difference in your risk. And, it's good to always have an idea of what is your body mass index. There's lots of charts. There's a fancy calculation here, but there's a lot of charts that you can look up online and, even on these websites, and they will show you compared to your height and your weight, whether you're in what would be considered a healthy weight range for your size. So that's called a BMI. So out of curiosity, it'd be good to go and look at your BMI and see if you're within the normal weight range for your height. It's funny, it says, are you an apple or are you a pear there? Well, I know none of us are fruit, but the way that we accumulate fat on our body is what they're comparing it to here on this slide. And people that have a tendency to have an apple body or accumulate a lot of adipose tissue around their abdomen tend to run a little bit higher risk, because that fat tissue is very close to our organs, very close to your pancreas, close to your heart, your stomach. So it causes a bit more havoc. And the pear, people tend to have more of the weight situated on their hips or to the buttocks, and of course is further than the organs, so tends to be a little bit less risk. But being overweight in general is a risk. So just knowing your body types is also a good thing. When we talk about alcohol consumption and standard drinking, so this slide we have here is the latest information on risk and drinking. So they kind of have a scale there. You see it goes green down to like a maroon color at the bottom, depending on the number of drinks that you have. And of course, they say, that drinking during pregnancy is not a safe option. So if you're pregnant, you should abstain from drinking alcohol. And so if you were to have no alcohol, then you should really have no risk. This is all in relation to stroke. 1 to 2 standard drinks per week, you have a low risk. 3 to 6 standard would be moderate risk, and anything 7 or more would put you at an increase or high risk for a stroke. And a standard drink is defined there because, like every other product that we get, in the stores or in the fast food, they're always upsized. They're much larger than what they were that I remember when I was a child. When we used to go for a Happy Meal, the cups were so tiny. But nowadays, you take your child for a meal and the drink sizes are enormous. So you have to remember that for alcohol consumption as well. So for beer, they're saying that standard drink is really 12 ounces of beer with 5% alcohol, because the beer also has varying percentages of alcohol in it. Or a cooler, that's 12 ounces or 5% alcohol. For wine, it's 5 ounces or 12% alcohol. And spirits like whiskey, vodka, and gin, you're looking at 1.5 ounces and no more than 40% alcohol for one standard drink. Just to go back on the drinking slide for a second, some people will say, well, 1 to 2 drinks per week, or however many drinks you have, can I just, save them up and drink them all at once? No, it really is within the week time period. You do not want to overwhelm your body with alcohol, because that would increase your risk. Smoking and vaping, so it doubles the risk of stroke and death. Secondhand smoke, of course, we know now a lot more than we used to know. about it, that it not only harms you, but it harms the people around you, and children with their growing and developing lungs. Quitting tobacco lowers your stroke risk rapidly, and you get body recovery as early as 24 hours after quitting. Within 5 years, if you remain smoke-free, the risk of having a stroke will be nearly the same as a non-smoker. So it's never too late to quit, and you can, see benefits from it quite immediately. There's a lot of people that are saying that vaping is harm reduction for smoking. In our stroke world, it is not, because the vaping still has the nicotine, and the nicotine causes the high blood pressure. And also, it's been found that in the vaping products, they have a lot of chemicals. So, so we do not see vaping as a harm reduction. In fact, we're advising people not to smoke or vape. If you're ready to quit, or you've never thought about it, or you're thinking about it, some of the strategies they say that can help is to set a quit date, have a plan to address the challenges that you'll face when quitting. And there's some help that you can look up online at myquit.ca. And some other things you can do is like make your home and your car tobacco-free zones, so that where you normally are in the habit to smoke, you don't smoke. Might make it easier to quit. And sometimes for coping with withdrawal symptoms from the nicotine, you can explore things like nicotine replacement therapy. Your physician can prescribe that for you, and also your local pharmacist. They're actually quite trained in dealing with nicotine replacement, and I think in some places they can actually prescribe it and help to monitor your success with the program. There's also Smokers Helpline that you can call, and I've included the number there. So yeah, quitting smoking would really help reduce your risk in stroke. And so that's my presentation, and I'm going to exit now. And I hope I'm doing well for the timing.
Absolutely right on time. It's
Oh,
7:45.
perfect. Yeah, I know that's a lot of information, isn't it, Rachel?
It was really informative though. Thank you so much,
Yeah,
Anna.
I'm trying to keep it as simple as possible. But yeah, I know it's a lot of information for people to absorb. And I see now we have 20 participants. Wow, this is fantastic. And I see something highlighted in the chat there. So I'm wondering if that's a question that we have.
I don't see any questions
Oh,
in the
okay.
chat.
I'm seeing a little marker in the chat. Maybe if I open it up, I'll see something here.
It's possible that you got a
Oh, thank you for attending. Okay, sorry.
Awesome. So at this point, before we start with the Q&A, I'm going to end the recording of this program, just so that we can feel free to ask questions without it being recorded to YouTube. So I'm going to say thank you so much, Anna, for that presentation. It was really great.
Wonderful.
I'm going to be
Thank
ending
you.
the recording now. Thank you.
Thanks.